Acha, so okay, are discussing some muscles. We will discuss the other topic after the class, inshallah. Discussing हम कर रहे थे कुछ muscles, intrinsic muscles का. सबसे पहले you should be clear about the intrinsic as well as the extrinsic muscles of the hand. The intrinsic muscles of the hand are those muscles which are having origin as well as insertion both inside the wrist and hand complex. On the other hand, जो extrinsic muscles है, they have origin outside the wrist and hand complex, and then they go somewhere else in the wrist and hand from the outside and just attach here. Uh, जो हम बात कर रहे थे कि जो तीनार मसल्स होते हैं, they are also four in number. Similarly, uh, there are hypothenar muscles. They are also four in number. Intraossei, they are actually eight in number, and among these eight, four intraossei they are present on the other side, and four they are present on the dorsal side. The muscles in the hypothenar, the thenar muscles, which make an eminence here, which is known as the thenar eminence, and muscles which make the thenar, they are four in number, and they're actually the opponent's policies, as well as this is the abductor pollicis brevis, this one, and this is the abductor, the flexor pollicis brevis. Palmaris longus is a small muscles, which in some books and some textbook it is considered as a muscle which is not fitting to any category of the intrinsic muscles, but in some books and some websites and internet-based textbook, this palmaris longus has been considered as the part of the hypothenar muscles. Otherwise, the other three muscles of the hypothenar muscles, besides that palmaris longus, they are the opponent digiti minimi and abductor digiti minimi and the flexor digiti minimi brevis. हमने जैसी पहले बात की थी कि यूजुअली जो हाइपोथिनार मसल्स दे वर्क ऑन द फिंगर एंड द थिनार मसल्स दे वर्क एंड दे फंक्शन फॉर द thumb. Similarly, जो पाल्मर इंट्रोसाई होती हैं यूजुअली वो एडक्शन ऑफ द फिंगर्स करते हैं, while on the other hand जो dorsal होते हैं यूजुअली दे their function is abduction. बाकी जो डिटेल है where they are coming in their attachment, the origin is that I think that will be not necessary for here. So we will just skip towards the uh, history of the patient, the questions and different aspects which should be observed, which should be checked while checking and examining, assessing a patient with the that wristband. It is essential to determine the mechanism of the injury which causing the wristband, because if we are known to the mechanism, then that will also help us in the diagnosing of that condition, that which structure may be involved here, what is the underlying pathology, what is that etiology for that wristband. A fall onto the outstretched hand may be severe enough to cause the fracture to the scaphoid, as well as it may also cause fracture to the distal radius. Along with the stress, the impaction from that push, they may also have caused some damage to the intercarpal ligament or damage to the triangular fibrocartilage complex. What are these intercarpal ligaments? We have discussed in detail. They are small ligaments which connecting the carpal bones to each other. These injuries, they are commonly encountered in high velocity activities such as the snowboarding, the rollerblading, or the falling up a bike. अच्छा, रोलर ब्लेडिंग जो है ये एक किस्म होती है स्केटिंग का. अपने स्पेशल बूट्स देके होते हैं जिनमें से कुछ व्हील्स या टायर्स जो होते हैं स्मॉल, ये एक लाइन में जो है 3 और 5 इन नंबर में होते हैं. एक होता है जो क्वाड सेट ऑफ टायर्स होता है जिसमें से 2 व्हील्स जो है बूट के साथ आगे लगे होते हैं, 2 पीछे लगे होते हैं, दैट मेक quadrate structure, that is two in the front and two in the back. But in the rule blading, usually the shoes, usually the equipment which is used, that the three or the five small wheels, they are present at the bottom of that boot, but they all are present in a single line. And the skating answer, that is known as the ruler blading. So these injuries, they are very common in such um, sports activities. A patient may fracture the hook of that helmet while swinging a golf club, tennis racket, or the bat, or striking a hard object. We have discussed these in detail in the start when we were discussing the epidemiology and the general discussion in which sports these wrist injuries they may be common. Similarly, rotation stress to the distal radioulnar joint and the forced ulnar deviation and rotation, they may also tear the triangular fibrocartilage complex. We will discuss the triangular fibrocartilage complex anatomy in the upcoming slide in detail. But when this rotational stress to the radioulnar joint, they may lead to the tear of these different cartilaginous as well as the ligamentous complex. In the history, it is very useful and it may help to in the diagnosis when there is determine the site of the pen, the where the pen is. It is the pen is present on the palmar side, on the olar side, on the radial side, on the ulnar side. Uh, Different causes there are which may cause the pain on the different sides. So these are some of the conditions which is clear to you people, which causing wrist pain on the dorsal side, and some of the condition which causing the wrist pain on the olar uh, wrist pain. So this is the scaphoid, the those which causing the dorsal wrist pain, they are the scaphoid fracture, the scaphoid infection syndrome, uh, scaphoid infection syndrome, and that is will be discussed in the upcoming slides. Fracture dislocation of the carpus, the lunate fracture, the distal radius fracture, the scapulolunate ligament tear, uh, the Kienbock disease. Sometimes it is also that ischemic condition, which is very rare but very unique as well to the that hand. The lenotriquetral ligament tear, the distal radioulnar joint injury, the carpal metacarpal dislocation, the carpal instability, and the hookup hamate fracture, they are causing the polar wrist pain. The detail about the distal radioulnar joint injury are the carpal metacarpal dislocation, or the Kienbock disease, or the scapular ligament tear. These all disease they will be discussed in the upcoming slides. Other important aspects of the history that may include that which hand dominance, which if it is the right or if it is the left, what the person is doing, what is their occupation, what is he do for the earning, that is he is related to computer related, the manual labor or the food service industry and so on. Um, the other thing which is important to note, that is the degree of reliance upon hand in the occupational, that how much he or she is using their hand in their tasks which are the demands of their occupation. Similarly, some questions should be asked about the history of past upper extremity fracture, including the childhood fracture injuries. Uh, Similarly, the history of osteoarthritis, rheumatoid arthritis, thyroid dysfunction, diabetes, that should be asked either they are having this condition or not. Any unusual sounds like the clicks, clunks, or snap, that should be noted and should be observed. Recurrent wrist swelling raises the suspicion of the wrist instability. So you should observe the patient for any swelling if there is any swelling, and to be the swelling is on which side. Similarly, should he or she should be asked about either whether he is musician or not, and if he is a musician, then the question related the number of years playing, the hours of practice per week, change in the playing, that complex speech, etc. That can be asked. But in case if he is a musician, and if he is not a musician, then this question has nothing to do with that person, that patient, and as well as if he is. Keep himself busy in the other hobbies like the crafts or the gardening or other activities. These were some simple questions subject to examination. Different questions should be asked, which can give us a clue that actually what the mechanism will be, or what is the underlying problem, or which structures they are under stress. And these questions, they will not give us the correct diagnosis, but they will help us in construction of that the most accurate and precise diagnosis. Uh, the examination involved observation. We will detail that what we can do in the observation section. Here it is just listed. Generally, we can check the active moments of flexion, extension, supination, pronation, both the ulnar and the radial deviation. And similarly, flexion, extension, passive movement that should be examined during the objective examination of that patient. Some areas that should be palpated, that is the distal forearm, the radial snub box, the base of the metacarpus, the lunar head of the ulnar, and the radioulnar joint. Special tests which can be performed to which and these special tests that will help us in the confirmation of those the diagnosis which are suspicious, which are based on the data which we have collected from the subjective and objective examination. And these special tests they include the Fisiform, the Watson test for the scapulohumeral injury, the stress of the triangular fibrocartilage complex, that grip jammer dynamometer. That is a specific device which is used to check the strength and squeezing of the hand. These condition, these equipments, that may be contraindicated in patient if a maximal effort is not permitted. For example, if the patient has some surgery related to their tendon repair. Dexterity, that Purdue pegboard, is a specific device which is used to check the dexterity of the hand. Now, what is the dexterity? Dexterity simple mean maharat, or we can say that dexterity is just simple the skills of the hand which can be used in some activity. Actually, why it is known as the Purdue Big Board? Because Purdue is the name of university, and it was just introduced for the first time by a professor in the Purdue University in 1948. This Purdue Big Board test. This is a rectangular board with a sets of 25 hole running vertically and four concave cups at the top. Some small metal legs they are placed in the cup on the side being tested, with subject asked to remove the bricks and place them vertically in the holes as rapidly as possible. The number of those bricks placed in 30 seconds is scored. This test is will be discussed in more detail in the coming slides. Similarly, the pickup test, which is another text for the checking the dexterity, that will be also described in detail in the upcoming slides. Then some sensations should be checked through the Semes-Weinstein and the monofilament testing, and as well as temperature should be checked in such patients. Tenor sand that can a special test which can be used for the nerve entrapment. Uh, I'm going to lead these students. In the observation, the wrist is inspected for the abuse deformity, suggesting a distal radial fracture. Swelling in the region of the radial snub box, they may indicate a scaphoid fracture, and inspect the hand and wrist posture, temperature, color, muscular wasting scars, normal arches of the hand. They should all be observed. So this is just observation of the hands. Active movements should be checked both the ulnar and radial deviation. Normal ranges for the radial deviation it is 20, and the range for the ulnar this is 60 degree. Pain and restriction of movement should be noted. Always compare motion with that of the other hand. Uh, so these movements can be checked through the prayer position and the reverse prayer position. In the normal range of motion for that rest extension, which is being adopted in the prayer position, that is 70 degree, while in that rest flexion, which is the adopted position which is that movement which is performed during the reverse pair position. This is the wrist flexion, and the normal range of motion for the uh, that reverse pair position. This is 80 degree. This is the palpation. The distal arm is palpated for the bony tenderness or deformity. This is the palpation of the radial snub box. This is the place where you have to palpate the snub box. This is the thumb and the two tendons which make the snub box that should be checked here. And sometimes this snub box, this is very subject towards inflammation. So it will be discussed in the upcoming slide as well. The proximal snub box is the site of the radiostylite, and the middle snub box is the site of the scaphoid bone, while the distal snub box is over the scapulotrapezial joint. This is just that and the proximal and distal division of the different areas of the snub box. Snub box is actually that anatomical site which is made by the depth or fossa which is made between the two tendons. Uh, the palpation of the lunate that can be done, that is the bony prominences, and this is palpated proximal to the capitate sulcus. The lunate tenderness they may correspond to a fracture. On the radial side of the lunate lies the scapulolunate joint, which may be bitter in the scapulolunate ligament sprain. This is the site of the ganglion formation. The ganglion formation that will be discussed in the upcoming slide as well. I'm just going and skipping and just reading these lines because these are very normal. You are all obviously maybe familiar with these all description. So that's why I'm just reading. If you have any problem, we will discuss in detail as well. So this is just the palpation of the lunate. Then the palpation of the head of ulna and the ulnar snub box. Usually, this head of ulna and snub box that should be palpated, and if there is swelling until then it's where the dorsal ulnar is spectra of the wrist, then that may indicate that there may be some fracture to the styloid of the ulna. Distal to the ulnar head, this is the ulnar snub box, and the triquetrum lies in this sulcus and can be palpated with the wrist in the radial deviation. Tenderness may indicate the triquetral fracture or the triquetrolunate injury. The triquetrohemate joint is located more distally than these, and pen here may represent the triquetrohemate ligament injury. So this is the place and exactly on that ulnar side where you can just palpate the that styloid of the ulna. And if the swelling, if there is swelling or if there is tenderness here, they may give a clue towards that if there may be chances of having some fracture to the ulna as well. The pisiform, a small bone which is present on the that ulnar side, that the pisiform is palpated at the flexor crease of the wrist on the ulnar side. Tenderness is this in this region may occur with the pisiform or the triquetral fracture. The hook of hamate, this is 1 centimeter distal and radial to the pisiform. Examination may show the tenderness over the hook or on the dorsal ulnar surface. So this is that point where you can just palpate the the piriform, the pisiform on that ulnar side. This is a small bone which is shape of the P, and the tenderness over there when there is on the palpation, if there is tenderness, they may give an indication of the fracture of the that pisiform as well as the triquetrum. Uh, some different scales that can be used to check the uh, functional and disability of the wrist and hand. And many valid and reliable assessment scales you will find in the literature when you search for that. Among these valid and reliable assessment, two of them, these are the patient rated, the wrist evaluation, and the other one, it is the disability of the arm, shoulder, and hand dash. There are two versions of this. Another version, this is the quick dash as well, and these both are the validated as well as the reliable assessment scale. Reliable, it means when it gives same results again and again. That is reliable scale. When it is used by a single person and it gives same results again and again, then when used different times but by the same person, then it is known as the intra-rater reliability. On the other hand, if different person, different therapists, different examiners, the physicians, they use a scale or test and it gives same result at the same time or at a different time, but it may be used when used it by the different therapists, assessors, then that will be known as the inter-rater reliability. So these scales, they have been validated and as well as they have a good reliability as well. So the different during the treatment session, the function as well as the disability of these hand and wrist that should be checked through these two patient rated wrist evaluation scale as well as the dash, which is the disability of the arm, shoulder, and hand. Special test. First of all, this is the Watson test. The Watson test that is used for the checking the instability of the scapulolinate. In the Watson test, the examiner places the thumbs on the scapite tuberosity as shown with the wrist in the ulnar deviation in this picture. Um, the wrist is then deviated radially with the examiner placing pressure on the scapite. If the athletes they feel pain dorsally where the scapulolinate ligament are on the examiner feel the scapite more dorsally, then it is an indication that there is some dissociation of the scapulolinate. So actually, this test that is performed for the checking the presence or the absence of the dissociation of the scapulolinate, or we can say that it is being used for the checking if there is any scapulolinate instability or not. Another test which is used to check the integrity of the fibrocartilage complex, the triangular fibrocartilage complex. In this test, the rest of the patient that is placed into dorsiflexion and ulnar deviation and then rotated. Uh, the therapist then will give the over pressure over that patient. And if that over pressure causes pain and occasionally clicking in patient with a then it may indicate some tear of the any component, any member of the that triangular fibrocartilage complex. So this is actually the demonstration of that triangular fibrocartilage complex integrity test. This that was that specific devices which we discussed previously, which was that Purdue pegboard dexterity test. This is a specific special test which check the dexterity. As we discussed previously, that this pegboard, this is a test which is consists of a rectangular board, and there are two sets of 25 holes in that board, and these 25 holes they are on vertically, and it consists of the four concave cups at the top as well. Then some small metal picks they are placed in the cup on the side being tested, with subject asked to remove the pigs and place them vertically in the holes as rapidly as the patient can. The this original application for the test was for testing the dexterity of the industrial workers, but still it can be used for the checking the dexterity and other workers as well. Usually, this test that take about 30 seconds per activity for a total of 5 to 10 minutes, including that are instructions. Um, this Purdue pegboard, why it is known as the Purdue? Because it was developed for the first time by a person name whose name was the Joseph Tiffin. He was a PhD and he was an industrial psychologist. He was working at the Purdue University in 1948, and that's why this big board that is known as the that Purdue pegboard dexterity test, as it was being developed for the first time in that university, which name was the Purdue. Uh, and this measures the dexterity for the activities that involve the grasp movements of the hands, fingers, and arms, and also those that require the fingertip dexterity. So that is the specifically those four cups and then metal picks, and the person will just put these picks into this hole vertically as rapidly as possible he can do. The investigation or the planned radiography that will be discussed in the upcoming session, inshallah. The next session there will be after the Isha prayer.